Coming up, we'll be on location at NTC Dental and Senior Smile in Rockville, Maryland, discussing the benefits of dentistry and how they can help improve your dental health and give you the beautiful smile you've always desired with one of this region's top dentists, Dr. Namita Chaudhary. Dr. Chaudhary received her DDS degree from the University of Maryland School of Dentistry, where she graduated in the top 10 of her class. Dr. Chaudhary is widely recognized as one of this region's top dentists. Welcome, Dr. Chaudhary. It's a pleasure having you on our program.
Thank you. I'm glad you were able to make it today.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. You're a very unique dentist, not only one of this area's leading dentists, but you offer a tremendous service, which we're going to get to momentarily as well. That'll help the community, people of all ages. But we also have some patients that are going to be joining us a bit later as well, Dr. Chaudhary. Yep. But I wanted to begin, if I may, by having you please tell us, what are some of the benefits of dentistry? Why is it important for folks out there watching to know that they need to go to a dentist on a regular basis?
Dentistry is very important to all of us. I think people fail to realize the importance of dentistry in our overall health. Studies have shown that there is a correlation between our mouths and the rest of our body, such as stroke, heart disease, diabetes. Studies are still being done on all those illnesses to show that anything that's in our mouth actually can lead to very serious problems.
You know, that's a great point. A lot of people don't realize that our dental health is connected to our overall health, and that's why it's so important to come to a dentist for regular checkups, cleaning, so on and so forth.
Exactly. So we advise our patients to be seen every 6 months so we can pick up on those things earlier than later, because then it might be too late.
Absolutely. Yeah. Now, what are some of the most common dental problems that you see at your practice?
In my office, I think I see the number one thing would be a toothache, which is very simple. They come in, we do a consultation, we take x-rays. I actually here in my office have digital x-rays, so we can take a picture and it'll show up right on the screen ASAP. And if we got to take a new angle or a new picture, we can do it right there, right then. We're able to look at that picture and then be able to tell them a treatment plan for that particular reason they came in, and give them their options. And if it's something we can do here, we take care of it, such as a filling. But if it's more than that, we may have to refer them out for a root canal, or if it's easy as giving them an antibiotic to just let it calm down and then come back to reevaluate. Or sometimes people have gotten a recent filling and just need a bite adjustment.
Yes, and you customize the solution based on the patient's specific need.
I'm a very basic conservative dentist. I actually keep their treatment plans very simple. And a lot of people get turned off by big treatment plans that are very expensive. So I actually also do mobile dentistry for the seniors. So I think I bring that into my practice here in the office of being conservative and leaving my treatment plans as simple as possible.
Yes, indeed. And speaking of mobile dentistry, that's what I definitely wanted to bring up during our interview today, because that is a tremendous benefit to not only senior folks out there watching, but also to homebound patients, including kids. Can you please elaborate, because that's a tremendous service that you're offering to the local community?
Yes, I love doing mobile dentistry. I service all the senior living communities around my office here in Rockville. I go out into Virginia. I am in the process of getting my DC license reinstated, and I do a lot of homes going up 270 north to Frederick. I've been doing this since I'd say 1999. And I love it. Yes, a long time. And I love it. Actually, there's a story behind it. As I was growing up, my dad was a veterinarian, and he actually practiced mobile veterinary services to elderly. And I never thought that was something I was going to do, but along the way, somehow I picked up on it, and I absolutely love it. So I have a mobile van, which has my name on it. It says Senior Smile, and basically it holds all my equipment, and then I go to these senior living communities, and then they set me up in a certain room, and I just set my shop up and I take care of the patients there. At the end of the day, it's very gratifying, because I also lost my parents back in 1999, and they actually were murdered, but I've been through a lot. But long story short, I actually feel, since I won't be able to give back to my parents, this is something I'm giving back to the elderly, who are like all my parents. So I feel like at the end of the day, I've provided a service that I'll never be able to provide to my own parents. So at the end of the day, it just makes me feel like a really good person, and helping them, especially because they cannot get to a dental office.
Yes, no, it's a tremendous service. I'm very sorry to hear about your parents.
Yeah.
And let's just say you're doing God's work. You're really doing great work.
I do believe it takes special people to do that, and you need a lot of patience. And I've always loved children, and really the elderly are just like children, so you have to be patient with them. You got to work with them. I mean, I've been spit, hit, slapped, pushed, everything. I mean, but you have to understand that they don't have control sometimes. I do a lot of dementia patients, and I also have a wonderful staff. I couldn't do it without my staff, because the people I hire, they have the same personality as I do, and they have the patience to work with these people.
Yes, indeed. So in addition to your state-of-the-art office here in Rockville,
Yes.
which sees people every day and helps them,
Yeah.
you also have that wonderful mobile option that you offer.
Yes,
And
and I don't only see people that are in the senior living communities. I also will go out and see homebound patients, and those could be people that were suffering from different illnesses that cannot get out of their bed. So they're bed bound, most likely accident prone, possibly, cannot walk, have spinal, injuries, sclerosis, just so many things are out there. And there are even children who are suffering from certain diseases that can't get out to a dentist. And the Maryland Dental Association, they're my #1 fan. They're always referring people to me. I'm one person, so I can't get out there fast enough, but I do my best.
Yes,
help
indeed.
everybody.
You're doing great work. You really are
Thank
for
you.
the community. And as far as the treatment options here that, a lot of people ask about, some of the more common ones, teeth whitening,
Yes.
cosmetic dentistry, dentures, so on and so forth. Can you please tell us a little bit about what you offer regarding those treatments here?
Yes, actually, alongside toothache, other problems that people come in with sensitivity and malocclusion. So those are two other things that we address a lot here at the office. Where toothaches, I have the rotary endo. I have state-of-the-art equipment. We can do a lot of those procedures here. However, most times I refer those harder cases out. Tooth whitening is very big here. We do at least 2 or 3 a day here. I actually put a lot of specials out through Groupon, Amazon, and Living Social deals. And people will come here because everybody wants whiter and brighter teeth. And we have good systems here. People leave with great results. And we also have minimized the sensitivity that goes with it. So we get a lot of people that will always ask about Invisalign as well. Invisalign are the clear braces that we do here, and that will help malocclusion. They're retainers that people wear and can fix their teeth without all that metal work in their mouth. And we do the simple cases here, especially people who've had ortho and haven't wore their retainer and have ended up with crowded teeth again. So they'll come in here and ask those questions as well. Sensitivity, we always have a lot of people who will come in here and we'll give them options of bonding with fluoride. And that also helps, resolve their issues with cold and hot sensitivity.
Very good.
I do implants here. However, I do not place the implants. I do the cosmetic part of the implant. I have great specialists that I refer out, and they send them back to me, and then we do the cosmetic result of the implant.
Now, what type of results can people expect from the treatments you've touched on here today?
Usually our whitening system is really, really good, and everybody leaves here with a very positive attitude and result. And they end up actually referring a lot more people back. And once the patients come in and meet us for such a small procedure, maybe to some people it might be a big procedure, but once they come in, they meet the staff, they meet me as a doctor, they usually come back and they need a cleaning, and then they end up needing a filling or two, and very comfortable, and then they end up usually being a patient of ours, which is the best compliment we can receive.
We're now going to meet some patients of Dr. Chaudhary. Welcome, Victor. It's a pleasure having you on our program. I wanted to begin by having you tell us about what your experience has been like here with Dr. Chaudhary.
I absolutely love her work. I love her care. I love her interest and her ability to make me look and appear the best that she possibly can so that I can do my job when I go out during the day and feel confident that I'm looking the best that I can look and I feel the best that I can feel from a dental standpoint.
And before I let you go, Victor, I wanted to ask you if you have any additional thoughts you'd like to share with the viewers.
I do refer her to my friends and family, all of which are currently using her. and I will continue to be able to bring her my business and to send her services that others need. She's one of the best dentists I've ever known, and hopefully most people will see it the same way I do, because she's fantastic.
Well, on that note, Victor, I'd like to thank you for joining us and being a guest on our program. Really appreciate it. Welcome, Carolina. It's a pleasure having you on our program as well.
Hi, thank you very much.
Now, I wanted to ask you, Carolina, if you can please begin by telling us what dental problem or problems were you experiencing that brought you to Dr. Chaudhary?
What brought us here was the fact that we were not happy with our previous doctor. I shopped around, really in the internet, to kind of find a doctor close to our house. Well, after the first visit, my kids were so extremely happy with the way the staff was extremely nice to everybody that we just kept coming. It's a very different dentist than what we had previously had, and I couldn't be happier.
You know, that's a great point you make, because that's what we hear from a lot of folks over the years, from patients' perspective, Carolina, is that a lot of times, you know, you go, because people have such a big fear of going to the dentist.
Absolutely.
And it's right up there among any
Yeah.
big fear that people have in their lives. And that it's so important for the dentist to make them comfortable, and because otherwise there's so much anxiety. And it sounds like when you found Dr. Chaudhary, that anxiety and that fear was gone that you had with your previous dentist that you and your
Yes.
family were going
Absolutely. And if you have little kids, which I do, it's even more stressful, I suppose, the anxiety that, oh, I don't want to go, I don't want to try a new doctor.
to. Yes.
And she just made everybody very comfortable.
I take it you and your family have had the routine checkups and the
Yes.
cleanings and all that?
We haven't had any major work yet. My daughter needs an extraction, in fact, in a few weeks. But it's been routine work up to now.
All right, very good. And what would you tell the folks who are watching right now, Carolina, your experience with the staff here as well?
The staff here is very professional and extremely accommodating. I have 4 kids that come here, and I try to make the appointments back to back, so I don't have to come, 4 days straight. And so with all the different schedules that we have to accommodate, I've never had an issue of rescheduling or not being able to schedule because they didn't have enough time.
Well, on that note, we'd like to thank you, Carolina, for joining us, sharing some of your experiences, and being a guest on our program.
Thank you for having me.
It was our pleasure. Thank you. Welcome, Louise. It's wonderful having you on our program.
Thank you.
Thank you.
Good to be here.
No, thank you for coming down. I wanted to ask you, Louise, if you can please tell us how long you've been coming to Dr. Chaudhary and some of the treatments you've had done.
Okay, well, I moved to Rockville from Virginia in June of 2014, having lived in Virginia for more than 40 years. And I spoke with my dentist there and asked for a referral here, and was told the only dentist to see is Dr. Chaudhary. So since June 14 of last year, I've been coming to see her, and I've been here frequently. She's done a lot of work for me.
Oh, and can you tell us what some of that work is?
Well, I've had fillings in my mouth since I was 16, and Dr. Glickstein did a great job, but I'm not 16, I'm pushing 70.
Yeah.
So she's replaced a lot of fillings, and I've got some other work that she's done, like filling in gum lines where people my age get receding gum lines from brushing their teeth too hard. And she's about to fix a tooth that's broken in half.
Oh.
So I've got a lot of work done.
Can you tell us about your experiences thus far here?
The best. And I had gone to Rick Schneider for 30 years. But, for example, Monday I was supposed to have an appointment here, and I was late, and she had a child to go home to, but she waited for me, and she did what I thought only the hygienist did. She cleaned my teeth, she did the fluoride treatment, she did the whole thing in half the time the hygienist does it. And it was, with my dental insurance, it was $134. So, and I'm coming back to have a tooth gap.
That's wonderful. So it sounds like she really gives the personal touch where when you come here, you're going to see Dr. Chaudhary.
She was in jeans and a t-shirt and needed to go home to her 5-year-old child, but she waited for me. You can't do better than that.
Yes, indeed. And before I let you go, Louise, I wanted to ask you if you have any additional thoughts you'd like to share with the viewers.
Yes, my additional thoughts are these. I know she's a geriatric dentist. I live in a place called Ringhouse with most of the people 20 years older than me. She goes to places where the elderly can't get out, and she's the top. She's the best dentist going. So anybody who's older who needs an outstanding dentist should see Dr. Chaudhary.
Well, on that note, we'd like to thank you, Louise, for coming down, joining us, sharing some of your experiences, and being a guest on our program. We really appreciate it. Thank you.
Thank you.
Welcome, Subhash.
I really appreciate that. I'm here that you invited me. And if I could say anything about Dr. Namita, it'll be my pleasure.
Well, we appreciate you coming down in your busy life to share some of your experiences with us. And I wanted to begin by asking you, Subhash, if you can please tell us how long you've been a patient of Dr. Chaudhary.
I'll say about 6 to 7 years, as I remember, maybe even longer.
Oh, okay. So
Right.
you've been coming for quite some time.
Yes, sir.
And what's your experience been like?
Actually, very nice and good experience with her, and she's very professional. Every time I came, any problem I had, and she knew her business, and she took care of it right away. And I'm really pleased since then,
That's wonderful. And can you tell us, if you don't mind, some of the dental problems that she's fixed for you?
Yeah, I mean, first of all, general taking care of cleanup, every 6 months, fillings. I had some problem with my actually gums were receding, so I had to put some resins, and then she had a plan for me.
Okay.
And I almost done almost within a year's time, So
Oh, that's
it took me,
wonderful.
But great job. I have nothing but praise for her.
Well, we're happy to hear that.
Yes.
And before I let you go, if you can please tell all the folks out there about your experience with her staff as well.
I always do that. Vanessa and all those people, they're so personalized. I come down there, they welcome you, and right away they know when your turn is. And I don't know what else can I say, Excellent place to be, and I will never leave this place. I'll always be here.
Well, that says it all right there.
Yes, sir.
And on that note, we'd like to thank you, Subhash, for joining us and being a guest on our program.
I really appreciate that you are taking my input.
We're now back with Dr. Chaudhary. I must say, you are really touching lives for the better. Look at Louise. Talk about mobile dentistry, senior communities. I mean, she's obviously was able to come to your office, but she mentioned that there's so many other folks older than her that you're going out to help every day. It's really powerful work that you're doing, Doctor.
Thank you. I really enjoy doing that. It's a big part of my practice, and my staff and I love helping those people.
Now, we're literally out of time, Dr. Chaudhary, but I wanted to ask you before I let you go, you and your practice, NTC Dental and Senior Smile, based here in Rockville, Maryland, really have established a reputation for excellence, not only in dental work, but patient care as well. I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
Okay, I think what might separate me from other dentists is I'm a very, like I said, basic and conservative dentist. And I'm actually trying to make treatment plans that work for the people and what they're in here for. I'm not trying to make Hollywood smiles. I'm just trying to give people comfort for the rest of their life with their mouths. I like to be able to cater to what they're coming in for and not just giving them something I think they should have just because I was taught by textbook to recommend that. I think my mobile dentistry that I do through Senior Smile has allowed me to bring that basic conservative dentistry into my regular practice. I actually am a very family-oriented person. I love my family, and family is very important to me. So I treat everybody that comes in that door into my office as family. I have a great rapport with them. When I first started, I used to actually do all my cleanings with them. Now I have a hygienist here. So I lose a little bit of that rapport, but when I go in to do my exam, I try not to be a face behind a mask. I actually try to just keep up with their lives, and in the 5 minutes that I have with them, I just try to find out what's going on, how their children are doing, or if I've seen their children, we'll talk about them. and just keep up with their lives and make them feel like they're not just a patient in my chair, that they're actually my friend or a family member, or that they're able to ask me anything they need to, and I'd be able to treat them like I treat my own. And I cater my business basically around my family. I have 4 kids, 13, 11, 8, and 5, and I love them to death. And I really just work the hours that I need to here at the office and try to be there for all my patients. So then as soon as I leave, I start my other, I guess, 24/7 job, being a mom, which I love to be.
Yes, indeed.
Yes.
You've got quite the life.
Yes.
You're doing so much good
Thank you.
to the community, helping people of all ages.
Yes.
And it was really a pleasure having you on our program today.
Yes, thank you.
You really are a very unique dental practice, and you treat people like family, and it
Thank you.
clearly shows. So
Thank you.
we'd love to have you back on in the future, Doctor.
Yeah, thank you so much.
Thank you.
Yes.